COVID is hitting our most vulnerable population, our seniors, very hard, as we have learned. To compensate, nursing homes and senior care facilities are closed to visitors, but that creates, of course, challenges of its own for the senior and for their families. So joining me now to talk about that is Christy Byerly, a licensed master social worker. Christy, thank you so much for being here.
Good morning, Sonia. Thank you for having me on.
So first of all, what are some of the most common questions that I'm sure you're flooded with questions right now, some of the most common ones that you guys are getting from families about their loved ones inside these facilities?
Common questions that we're getting is, how are they doing? No one is able to go inside and actually see their loved one, and so that adds a lot of stress. We're having questions about if they should take their family member home with them, if they should leave them there, what new Medicare regulations come out, and as they change every single day.
So for that big question, should they leave them there? Should they take them out? We've heard the county judge talk about this earlier on. What are you advising people now?
Correct. It depends on the situation. The county judge, his mom was in an independent living, and that could be a good time if you were waiting to put someone there. It might be a good time to wait a little bit for that, but it becomes more difficult with more dementia, more care needs. And it can be very difficult to be able to take care of someone at your home who needs 24/7 around-the-clock care. Then a lot of the facilities have doctors that come in. Then you would have to worry about getting your family member to a doctor's appointment. There's lots of challenges, and it's very individualized based on how much care your loved one needs.
Yeah, I mean, and I think that's a good point to sort of re-emphasize, right? It's really so unique to the person, their specific health needs, and then the type of facility you're talking about, because unless you're familiar with, senior living facilities, there's sort of a wide range of services provided in a lot of these different facilities.
Correct. Anywhere from 55 plus apartments who receive no care needs, all the way up to assisted living, memory care, and even residential care homes. It all depends, and I feel like it's worse when someone does have dementia, because then they're still confused on everything that's going on. And what if they try to escape? It would be hard to, along with all the other stressors right now, like working from home, and if you have small children at home, just bringing someone home who's in a safe environment may not be the best option. Leaving them there and where they have care around the clock could be the right option.
So what do you tell families who might have sort of an emergency situation and either need to, feel like they need to place someone in a facility or even remove someone due to an emergency, something urgent?
Sure. So in emergency situations, we are still helping families who need to get to an assisted living or residential care home for continued care. And we are able to, senior living specialist is able to help know who's accepting new patients, know who's not accepting new patients, if there's a quarantine period, which a lot of the communities are having right now. And then just making sure that it's going to be the right fit. Some communities are not allowing additional outside therapy, like home health or physical therapy, to come in. So that makes a barrier as well, too.
And speaking of barriers, a big question in my mind is the financial barrier right now for so many people. I'm not sure what you recommend or advise for people who've maybe lost their jobs, they're furloughed, they're still trying to pay for some of these, frankly, high cost facilities. What type of resources or help is out there for those people?
One of the good things about what's going on right now is that a lot of the communities are not getting a lot of new residents, so they are having some specials that they can help accommodate if they need help with the financial piece. And that brings another point off. If you move somebody out of a community, you might have to pay again to move them back once this is over, like the move-in fee or community fee. So that could be an added burden, and having caregivers at home can add up. It could be $18 to $25 an hour to have someone at home. So there are lots of financial things to think about when you're trying to make these decisions.
Do you have a particular resource or website or something that you can point folks to if they need more help or information with regard to seniors and loved ones really who are in some of these facilities?
Absolutely. Like I said, Senior Living Specialist. It's www.seniorlivingspecialist.com. And phone number is 214-929-5055. And we would love to help with anyone who has any questions, even if they're not in a community, just having any general senior questions. There's 2 licensed social workers on our team, and then we have 10 other people. So we have lots, over 130 years experience in the senior community. So we can get talk with you and see what's going to be the best resource for you.
Wonderful. Christy, thank you so much. Thanks for all the work you guys are doing, and we really appreciate your time and insight when it comes to this particular slice of life. You guys stay safe.